right, my name is Megan. I'm going to be performing a physical assessment on you today.
Okay,
Do you have any chief complaints or anything that's bothering you?
not right now.
Okay, so we're just going to start right here with your scalp, and I'm just going to feel your scalp, your masses nice and round. We're going to feel your sinuses, your frontal, and then we'll do your maxillary. Those feel good. And we're going to look at her eyes now. You want to go ahead and take your glasses off? And I'm just going to check her pupillary response and then also how she can follow. So can you follow my finger? Perfect. And then, good. And they're nice and symmetrical, both the same size with the same response. So now we're going to check the ears. We'll just take a look inside both the ears, make sure they're symmetrical. Okay. Now I'm going to do the nose, and we can just look. You can use a light if you like. Are you having any problems breathing? Good. Now we're just going to check the mouth, and you can use a tongue blade. And I'm just going to use a flashlight. And can you say ah? No redness, no tongue swelling. Everything looks good. No pus, no masses. And you're not having any problems breathing through your mouth, swallowing?
No.
Okay. Now we're just going to go to her neck. We're going to check her lymph nodes, symmetry. You can check her carotid pulses separately. And those are nice and strong and equal. No JVD. Looks good. Okay, so now that we're done over here, we're going to go through it, and I'm going to stand behind her. I'm going to take a listen to her lungs. First assess, I would assess her skin also, and, feel her temperature. Can you go ahead and just take a nice deep breath for me? You can palpate. Now I'm going to listen to her lungs and have her take some deep breaths. Now I'll go ahead and have you lean forward a little bit, and we'll check your spine. It's nice and centered. All right, and then we come back to the front, and we're just going to assess her chest. And just feel around, and then we will take a listen. You take some more deep breaths for me. Good. All right, and then we'll listen to heart sounds. Nice and even, no murmurs present. All right, and then we would just check her range of motion on her arms. So if you could just go ahead and bring your arms around and then hold them out, and I'm going to press down and pull up. Perfect. You can relax them at your sides. Okay, and then for her breasts, while she's sitting up, we would just check for symmetry. And then the rest of the assessment is when she's laying down. Now we're going to go to her abdomen. Oh no. That's when you're laying down. Yeah, you can go ahead and lay down. You put your glasses on. All right, and now that she's laying down, we can check her breasts. We can check for any lumps or tenderness. For the skin assessment, you check for any reddened areas. And we can go ahead and feel her abdomen. Listen to her bowel sounds. That's good. And then after that, we would just go to her groin, and we could check both of her femoral pulses, make sure they're nice and strong, make sure there's no swollen lymph nodes through this area as well. And we'll go to the lower extremities. We'll do a skin assessment. We would check pulses, And we'd also feel for any edema in the lower extremities. And then I would take her shoes off and we would check her pulses, both of her feet. Alright, and then we're also going to check her range of motion here and her strength. So can you lift this leg up? Stay up. Good. And this one up. Stay up. Okay, and then could you press on my hands? Okay, that's good. Alright, so we checked all this with her laying down. Now you can go ahead and sit back up on the side of the bed. And this is where we would just focus on her neuro assessment and we would do all her reflexes. So hold her arm up, check back here, here, and check her knees. I don't have the hammer. And then we would check Achilles. You want to make sure that their feet are dangling whenever you're doing this as well, to make sure your reflexes are the same in both sides. And then after that, they can go ahead and stand up. And we'll check musculoskeletal. Would you take a few steps for me? Okay, and you can come back. Alright. And then after this is when you could perform a genitalia assessment. So she would lay back down and we would put her in the lithotomy position and we would do a vaginal exam and followed up by a rectal exam. Alright, thank you.
Thank you.